So this part is on Organon of medicine, where we shall be covering the case taking, the practical aspects, the aspects which experience teaches us and throws light on those particular features which shall be helpful in treatment of the case. Important aphorisms have been chosen here, on which we shall be highlighting our talk, and these are aphorism 88, which is about covering the areas left out, then aphorism 90, aphorism 93, aphorism 94, aphorism 96, 97 and 98. Even if you forget the number of the aphorism from which it is there, it does not make any difference. What is important is the points which are given in these aphorisms, and it really is astonishing that how so many years before Hahnemann could describe these things and how they are relevant even today in the current practice of psychiatry. We are to apply that. So first of all, we go to aphorism 88. Hahnemann says here that if the patient comes and tells you about certain things but forgets about telling certain things, then you are to cover those areas, and that is certain parts and functions. That means which parts of the body have been left out by him, which functions of the body have been left out by him, and refresh the memory of the patient towards these particular aspects and get it from them. In the footnote to this, what he has written is that avoid leading questions. Yes, no questions should be avoided. There could be questions which could be multiple choice questions, or there could be hints given, but not telling the answer of which could be in yes or no, because patient is likely to say a wrong answer over there. Then he says, inquire into emotion. This is what is written in this aphorism about temper, that is state of mind, frame of mind. Then mental power, that is the memory of the patient, is to be assessed. Now this in the modern psychiatry is described as mental state examination. Now mental state examination covers consciousness and general appearance and behavior, then the cognitive functions, the functions which involve thinking, then thought, higher reasoning, then thought is associated with speech, because what you think you speak, that is thought, then mood, perception and insight. These are the factors which are covered under mental state examination. In psychiatry book you will find a focus on these factors. Now here it is very interesting to note that Kent and Hahnemann have got divergent opinions on these. Now Kent says memory is less important than will and understanding. That is what we have read. He has described will, understanding and intellect. Under intellect it is memory, and memory is least important, he has said. But cognition is higher, and cognition covers memory. Cognition is under cognition, memory is covered. So memory comes under cognition. So that means that cognition is most important. So memory also is very much important. And that is what is the current psychiatrist opinion also, and Hahnemann also has said that. Then suicidal ideations. Suicidal ideations are the ideas are related to thought, whereas understanding is related to perception. And one modern feature, add one more modern feature, and that is when the patient gets up in the morning. You ask the question that how do you feel after you get up in the morning? That is very important, because the first thing after patient gets up is quite important, and lethargy after waking, sluggishness, lethargy lasting for a long time is a sign of depression. And depression patients are, secondly, remember, they speak less, reticent, that is, they are quiet. They are quiet, that means that they are likely to be having depression. Patient who speaks too much is likely to have anxiety, because anxiety patient cannot sit comfortably, cannot sit in one position. Like, we describe Uthla tar Hanuman, Basla tar Ganpati. So, Basla tar depression, Uthla tar anxiety. You can understand like this, because these are restless people. The restless model is anxiety model, and this model of sitting, quietly sitting, is depression. So this is the difference between Hahnemann and Kent, and wherever there is difference between Hahnemann and Kent, we must give first preference to what Hahnemann has said and try on the patient and see if the results come. If the results do not come, then it is a different thing. Second aphorism we take is aphorism 90, that is physician's observation and healthy state. Now here there are certain observations like morose. Morose means sad, dukhi. This is a sign of depression. This means depression. In fact, waxed word is more accurate. Chid-chid, ghin-ghin. But then that chid-chid or waxed is more suitable to elderly people. Babaji ghin-ghin hai. Means at old age the persons are known to be vexed. They are not happy and they are sad, and that is an anger, sense of anger is included. So morose word expresses depression. Rubric's interpretation is directly related to this if we take the help of psychiatry. That is how we have enlisted, and Hahnemann has said this in aphorism 90. Quarrelsome. If the patient is quarrelsome, then what will you think? He quarrels. He quarrels with the neighbor. He quarrels with the family member. He quarrels with his boss. He quarrels with his pupils. And finally, you come to know that he has psychosis, because he is not at ease with himself, and delusions and hallucinations will be found in that patient. Then hasty, in a hurry, always in a hurry, not having any time. That is hypomania or anxiety. Then lachrymose patient, weeping, that is depression or anxiety. It could be both of them. You have to differentiate. Then anxious is anxiety disorder, depression, OCD, delusional disorders. These delusional disorders are a type of psychosis disorders. Then despairing or sorrowful. Despairing or sorrowful patients are also having depression, OCD, dementia or schizophrenia. There are some more points here. That is confident, hopeful, cheerful. The patient is very confident. But you come to know that he has mania. He has hypomania. Then very calm, does not say anything. Depression or schizophrenia. Then drowsy patient, could be a drug addict. If you come across a drowsy patient. Unconscious patient, cerebral intoxication. Then hoarseness of voice. गला बैठ गया बोलते बोलते, आवाज ही नहीं निकल रही है. It could be a manic patient who is howling, shouting so much that ultimately his throat is hoarse, voice is hoarse. Then whispering, low tone, इतने धीरे बोल रहा है कि डॉक्टर को ही नहीं सुन रहा, क्या बोले. Now these are the hysteric patients. Then incoherent speech, क्या बोल रहा है कुछ समझ में नहीं आ रहा है. Incoherent speech cannot be understood. That is a sign of mania. Then we go to aphorism 93. Under aphorism 93, Hahnemann tells to investigate the hidden causes, and that is, in acute or chronic diseases, there could be some unfortunate incident which patient hesitates to disclose. He does not tell you. You have to be alert to that. Suicide or poisoning, there is a history of, he does not tell. Masturbation, then sexual excess of unnatural kind, which could be paraphilia, sadism, masochism, then pedophilia, that is child abuse, then intoxication, and there could be a big stress factor, and stress factor can be because of unrequited love. Somebody is loving somebody but does not get response. That could be love between heterosexual love, that could be love which could be about anything, but then there is unrequited response is not there. Then jealousy, then domestic discord, unhappiness at home, mortification, that is anger with suppressed anger, and then grief in consequence of some family misfortune, that is some death of near and dear one could be there. Then maltreatment, then suppressed feeling of revenge, humiliation, insult, financial loss, and superstitious fear. Somebody tells you, तुम्हारे भाग्य में ऐसा लिखा है, something like this will happen, and then that due to superstition, a fear is involved. Now here stress, we can divide stress into certain types. That is, it could be an occupational stress, it could be marital stress, it could be familial stress. Remember, role of dowry here. This familial stress, recently married, and dowry role of, though it is getting very much diminished, but no, with financial status, the race for dowry is still on, and that factor is very important. Then financial stress, social stress, then bereavement, that is death, health, and miscellaneous factors. Search for stress and hassles in family if you want to detect depression, if you want to detect anxiety disorder, then obsessive compulsive disease and delusional disorders. Then look into the family matters, ask who are the persons there in the family, take the topic to the family and try to unfold this. Then after this we go to aphorism 94. This aphorism 94 tells us about obstructions to cure. That is, which are the factors which could be obstructing. You can find those in occupation, you can find those in mode of living, you can find those in diet and domestic relations. We will go into these three in details, but first let us enlist. Then there could be factors which are given in footnote and Hahnemann's chronic disease. These factors are premenstrual syndrome, sterility, pregnancy, miscarriage and childbirth, then sex desire suppression and incapacity. This has been described by Hahnemann in this aphorism 94, which is the biggest storehouse of psychiatric information related to case taking. So we will try to analyze or go through them one by one in short. In occupation, if there is a meager income, then it results into family disturbance. That is an important factor. Then mental tussle with colleagues or superior authorities, if that is there. Then if the job is temporary, the permanent job is not there, or the working place could be noisy like an workshop, some disturbances there. In case of working women, there could be sexual harassment, there could be double responsibility. There is double responsibility, doing homework as well as doing the work in office, and they are looked with suspicion. A male member and a female member, society has different norms, so we have to see whether that factor exists there, and to handle, to explain to the patient, as also to cover it as a stress factor. So that is occupation. Then about mode of living. About mode of living, it is said that stress could be related to job dissatisfaction, then it could be related to burnout, overwork, that is self-abuse, as we have used the word there. You will find both these topics of today are correlated to each other. One is under the current medical knowledge and second is under homeopathic case taking, because this is what you have to correlate them. Then victim of monotony, means no new thing, boredom, monotony, indifference, depression, vexation, then aversion to work, etc. These could be the factors which have to come out in the case taking. Then unemployment. Unemployment is physical and mental condition, and because of unemployment there could be headache, stomach trouble, hypertension, stroke, anxiety, there could be depression, there could be resentment, that is anger, there could be spouse abuse or child abuse because of unemployment, beating the wife or beating the child, marital or family problems, then thoughts of suicide, etc. These could be because of unemployment. Then under diet we see malnutrition. Undernutrition, malnutrition could mean both, either eating less or eating more. Both are malnutrition, which is called undernutrition or overnutrition. In large family, normally there is undernutrition, whereas in nuclear families there is overnutrition. And then obesity, easy availability of delicious food, much fat and sweets, and less fiber. And then lifestyle diseases could be diabetes mellitus as well as hypertension, where the lifestyle of the patient is at. Then after this, we go to the aphorisms, that is footnote of this aphorism, and under which this premenstrual syndrome, that is physical and mental changes before menses. Now this particular thing, very interesting to note, that the name premenstrual syndrome has appeared in medical literature in 1953. Before that, this word was not coined. But from 1931, the description of this condition has been made under, that is without name, that the women have got some mood disorders, some difficulties before menses. We were just writing as modality before menses, complaints before menses, but not listing them like this. And Hahnemann particularly paid special attention to this condition, and that's because it is found in 30 to 80% of females. That is nearly 1/4 to 3/4 of the females, this premenstrual syndrome in menstruating women. It results in anxiety, it results in irritability, sadness, hopelessness, lethargy, and child beating, suicidal thoughts, mood swings, and even antisocial behavior. It is a different thing that if it is normal to this extent, it will not go. It is a different thing that it is self-limited, after some time it disappears. It is a different thing that the duration of it may vary from person to person. But remember, when a patient comes to you, then she is a person who is suffering from these complaints. So be in search for these factors and attend to this premenstrual syndrome. That is what Hahnemann at that time has said. Then symptoms start. When do the symptoms start? After ovulation itself. Then that is after 14 days. Worst 5 days before menses. Then associated features here are recurrent depressive disorder, then hypomania or bipolar mood disorder. Then especially in those who had history of depression, this is more, mania also, or psychiatric episode, in them this premenstrual syndrome or PMS is found more. Then we go ahead. It is quite a interesting thing to know that diseases which aggravate in premenstrual period have been enlisted, and these are at the topmost list. One is migraine. Mostly women have headache or migraine before menses. Then asthma. Even the asthma people have got aggravation of this. Allergies and fits, seizure disorders. So these are the conditions which are aggravated. These are the diseases which are aggravated in premenstrual period. Then sterility, pregnancy, miscarriage, etc. First of all, let us see sterility and infertility, where inability to conceive. Now when this is revealed, that is when it is diagnosed by gynecologist that the person has got sterility or infertility. First of all, there is shame, loss of self-esteem, depression, and here it is very important to concurrently also explore the possibility of erectile dysfunction and azoospermia in male. Of course, before diagnosing, the gynecologist will get all these factors examined. But it has been emphasized that erectile dysfunction and azoospermia are commonly associated with this. Let us go ahead. In female, hypothyroidism is related with depression, we have seen. So here it is related with sterility and infertility because of the role of estrogen. Then polycystic ovarian disease, PCOD. This PCOD, there is commonly associated with depression or mood swings. Then with respect to pregnancy, pica, that is ability, desire to eat indigestible things, is pica. That indicates anemia. And remember, it is not only in human beings. My cousin, who is a veterinary surgeon, he told me that when cows start eating pepper, that means they are anemic. A healthy cow does not eat pepper. It applies to other animals also, but cow being a domestic animal, he has told that. So this indicates that this sign of anemia, and because during pregnancy there is common condition anemia, so this symptom is found. Remember, pica is also found in schizophrenia. In schizophrenia also they eat indigestible things. Then stress leads to miscarriage, premature delivery. Then stress in child, because if because of stress the child is born with low birth weight, with respiratory problems, with digestive disturbance, with pyloric stenosis, even cleft palate, which we have seen earlier lecture also, problem in speech or learning, and even ADHD, that is restless or hyperactive child, that is ADHD condition, is also associated. Now childbirth and miscarriage also are covered here. Prolonged labor, if the labor is prolonged, there is lack of oxygen, there is anoxia, and because of this the brain of the newborn is affected and mental deficiency occurs, cerebral palsy, CP occurs, learning disabilities occur, and 20% cases of schizophrenics have cerebral anoxia at the time of birth. Then miscarriage, particularly third trimester, that is mental shock. It causes mental shock. If you are noting down in the history that abortion occurred, miscarriage occurred, note it third month. Remember, it is associated with mental shock. So you have to note it as a mental shock. Then sex desire, suppression and incapacity. First of all, we see sex desire. Unfavorable husband-wife relationship reduces sex desire. Tension types could be familial tension, business tension, or economical tension. Then libido, that is sex desire, decreases with chronic stress, one. Second is anxiety. Third is depression. Then use of antihypertensive drugs. Nowadays they change the drugs, but unless the person tells to the physician, he is not changing the hypertensive drugs. So if the patient is taking some antihypertensive drugs, and remember, it has got its role in reducing the sex desire, causing impotency also, then it remains intact. Sex desire can be maintained by the positive factors have been enlisted: self-confidence, proper companionship, and good rapport with partner, not only at the time of sex, even in non-sex matters. This is very vital. Good understanding has to be emphasized. Then excessive sexual desire is seen in mania, is seen in hypomania, that is milder variety, and in early stage, primary stage of dementia. In patients having dementia, they have got increased sex desire. Then unmarried persons with suppressed sexual instincts has been written by Hahnemann under this aphorism. It's very interesting that Hahnemann lists 4 conditions in chronic disease, not in aphorism footnote. He says so in chronic disease. I correct myself. That is, hysterical state is one condition, which is conversional disorder. Second condition he describes is hypochondriac state, which is somatic anxiety. Both first and second come under somatoform disorder. Here physical symptoms without evidence of physical etiology. Cause is not found, organic cause is not found, but the symptoms are there. and symptoms are beyond his or her control. That is, patient is not producing those symptoms. Patient is not feigning. It is not to gain some advantage. And there is no role of personal will or desire. Then next, third is melancholy, depression or mood disorder. Third condition, where unmarried persons with suppressed sexual instincts, means age is there, long period is there when marriage has not taken place, and they come with certain conditions. So note it. Then insanity. Now it sounds very strange, but it has been described by Hahnemann as old maid's insanity, elderly lady having insanity because she is unmarried or she is a widow. Then because these factors, not widow, unmarried, these factors are that four conditions: either she has been unattractive, having belonging to lower socio-economic background, that is why forced celibacy is there, could not get married, socially empty, lonely, withdrawn life patterns, and conium mat has been described as a remedy for that. Now this here is a different matter, that how a person in spite of this condition can also remain healthy. But here when a patient comes, this factor has to be remembered by us. Then there is a condition called incapable of sexual intercourse. This is called sexual desire disorder. I am covering from this aphorism. I am not covering from anything out of this aphorism. It is related to this. Hahnemann gave the importance of this at that time. So you can understand at today's time also, this factor has to be seen and remedied. Sexual desire disorder, which is hypoactive sexual disorder, could be hypogonadism, that is organic disease. Then second is sexual arousal disorder, which is organic disorder, premature ejaculation is there. Atherosclerotic disease of penile artery, there is atherosclerosis, and as a result in fact the erection is not there. These disorders are described into two. One is erectile disorder and second is disorder related to ejaculation, that is ejaculatory disorder. Male sex disorders are classified into two. Then sexual dysfunction due to general medical condition, which is diabetes mellitus. Substance induced sexual dysfunction, that is due to intoxication, alcohol, tobacco, etc. Even drugs, which is like antihypertensives, could be responsible for incapacity of sexual intercourse. Then commonest causes of erectile dysfunction have been enlisted here. Psychological factor is found most common. Nearly 88%, up to 88%, anxiety, depression, fears, low self-esteem, then marital discord, then relational conflict, loss of attraction, conflict over sexual performance, and sexual abuse in childhood. Again that memory coming. So these are the commonest causes of erectile dysfunction. Then no other physical ailment causes so much frustration and shame and defamation as does this condition. So remember that if this condition is existing and you are not able to take out from the patient this condition and cover this aspect, your treatment will not reach up to the mental level, because this is and patient is not going to tell this to you unless he comes to you for that treatment of that condition. But he is coming for the treatment of some other condition which is the result of this. It is very interesting that in about 50% of divorce petitions, husband and wives in India sue each other for this factor. So they sue each other for this factor, that because of erectile dysfunction or inability to perform intercourse, that is frigidity in female, this particular case is happening, and even wrongly also this is enlisted. Rightly, wrongly, of course, in court both matters are there. Hahnemann tells in chronic disease that this is curable with antisoric treatment. It may need antisyphilitics also, because example is that in tabes dorsalis, syphilitic condition, there is impotence. So this is about the erectile dysfunction. Then we go to next aphorism, aphorism 96. Aphorism 96 tells that the descriptions of people differ. You see the serial CID on TV, and many detective serials are there, where subsequently it is learned that person tells you something which is not truth, but he tells in such a way that it looks like a truth. That is about falsehood. Here we are not talking of falsehood. Here we are talking of descriptions. Descriptions differ. Some people have exaggerated expressions. और मालूम इतना सर इतना ज्यादा पीरियड हुआ पूरा बाथरूम भर गया, बाल्टी भर के हुआ. अब now the description that bucket full of blood was there. Now bucket full of blood, if you have a little blood and put it in a bucket full of water, the entire water will become bloody. So this is the she is not lying, she is just exaggerating. And remember, exaggeration is a sign of literature. If you have read Ramayana, there is doha, bhoop sahas dal ek hi bara, lage uthavan taran natara, possibly chaupai or so. Now that is, he says that at the time of Swayamvar, there were 10,000 sahas dal, 10,000 kings who came and tried to lift that bow, but that bow was not moved even an inch. What is this? This is an exaggeration, a beauty of literature. Because 10,000, why 10,000? Even 20 or 30 kings cannot stand by the side of a bow. So 10,000. So there is an exaggeration in poetry. So similarly, there are persons who tell you exaggerated expression, no fictitious accounts. They are not telling imaginary things. Then here you have to see and compare by giving placebo. Hahnemann tells, give placebo and see the difference, because you can differentiate. Then high pitch, Hahnemann says here that high pitch symptoms, exaggerating symptoms is also a symptom. Don't get irritated on the patient. Catch hold of that rubric and prescribe him or cover this symptom. Then there are maniacs who are very fast and loud in their speech. Then they rapidly shift from one topic to another. So on the basis of different descriptions, Hahnemann tells how we have to interpret that in case taking. Then in insanity and schizophrenia, there is sudden interruption during speech. बोलते बोलते चुप हो जाएगा. Then there will be vague talking here and there. Then fabricators or feigners are also there, who are intentional liars. Then no corroboration, these accounts don't match, and this is a conscious behavior. So in short, this aphorism tells us about the differences in the description which is to be kept in mind. Now aphorism 97 we go to. Another kind of temperament is there. There are people who speak so little that they hide, they withhold, they do not tell you the symptoms. There is false modesty, either due to shame or bashfulness is again shame. Then they describe in obscure terms, consider this symptom, they consider symptoms too insignificant to mention. Why to tell you this is such a small thing, I did not find that necessity to tell you. So this also is matching, or rather the other side of aphorism 96, which covered under aphorism 97. And last is most important, that carefully obtain patient's own statement. Precise expressions are necessary. Friends and attendants can tell you something, but they may misrepresent. Finally, what is true is what the patient says. Investigation of chronic disease, he finally says, involves or demands, first of all, great caution. And second is reflection, that is thinking. You have to think over every symptom. Then knowledge of human nature is required, that is study of psychiatry or psychology is required. Careful inquiry is required, and unlimited patience is required. That is, you are not to lose your temper, you are not to lose your patience, and that is what is important aphorisms on case taking. So if there are any questions, we can go ahead